My name is Robert Bache, Medicare Bob. I own Senior Healthcare Direct, and my agency and I help people nationwide with Medicare insurance. In this video, I'm going to talk about the most important decision somebody new to Medicare is going to make, which is Medicare Advantage versus Medicare Supplements. Now, the reality is there's no wrong or bad answer. It's just, I feel like a lot of the advertisements are misleading, and I'm a big fan of educating people and helping you choose the right Medicare coverage for you. I have helped people where I've helped someone choose a Medicare Advantage plan, and they will have their sister from a different state or even across the street call me, and we end up fact-finding and doing our research with that person, and we end up helping them get a Medicare supplement. It's vice versa. I've helped someone with a supplement, and they refer somebody, and then we get them a Medicare Advantage plan because we educate them, and that's what they choose. Here at Senior Healthcare Direct, Medicare Bob's office, we're big fans of educating you so that you can choose a plan instead of being sold a plan. So this is going to take a little effort on your part, but I'm going to put a T-chart behind me, and I promise you here that just in the next few minutes, you will understand the core differences between Medicare Advantage and Medicare Supplement, and then you can decide which is best for you. I'm going to follow along with the chart just so I stay on point here. So you're going to see Medicare Advantage versus Medicare Supplement. The first thing you want to understand about Medicare Advantage is it's not a Medicare supplement plan. It does not work with Medicare. It's going to work instead of Medicare. Now, you're still a Medicare beneficiary, so you're still entitled to Medicare, but it's really just a private alternative to original Medicare A and B. So the first thing you have to understand is it's not going to pay like the 20% that Medicare charges. It's going to just replace what Medicare charges with that own private company set of bills. You also have to understand that you're giving up your right to go to any doctor, any hospital, nationwide. If you choose a Medicare Advantage plan, those benefit packages are negotiated typically specific to your county, sometimes in a tri-county area. But it's important to understand that if you choose a Medicare Advantage plan, you will have a network, either an HMO or a PPO plan, meaning you have to get referrals, prior authorizations, and you have to work with your insurance company to get your care. And you have to go to a primary care physician and get referred out, which a lot of people are okay with, but it's just important that you understand that if you choose an Advantage plan, that's what you're going to have to do. Now, you see Medicare Advantage plans advertised all the time as zero premium plans. The reality is they're the same price as Medicare. They're not zero premium. Now, in some areas, they're zero premium plus maybe $66 or $50, depending on where you live. If you live in a rural area, there's usually an additional premium. But a lot of times on TV, you see these plans advertised as zero premium plans. So a lot of people think they don't have to continue paying their $144 to Medicare. And the Medicare Advantage plan system, unless you're getting a rebate, the zero premium plans you see advertised on TV, you still are obligated to pay that $144 Medicare Part B premium. Now that premium will go to that private insurance company, and you won't use your Medicare Red, White, and Blue card anymore. You'll use whatever plan that the carrier that you chose sends to you. So you see them advertised as zero premium, but it's important to understand you're going to pay that Medicare Part B premium regardless. And it's not free. It's really the same price as Medicare. And I kind of touched base on this a little bit earlier, but the reason it's the same price as Medicare is because it doesn't actually supplement your Medicare. It doesn't pay what Medicare would charge you. Instead, it's going to replace it with its own set of bills, own set of copays and deductibles. So here's a couple of examples. If you have a Medicare Advantage plan and you go to the hospital, Medicare, if you have just Medicare, it's going to charge you about $1,408 in 2020 every time you go to the hospital. Well, if you have an Advantage plan, it doesn't pay that $1,400. Instead, it's going to replace that with its own charge. And what I've seen nationally for 2020 is around $300 each day you're there, days 1 through 7. So if you go for 4 days, okay, it's $1,200. That's a little bit less than the $1,400 Medicare would have charged. If you go for 6 days, now it's $1,800, which is more than what Medicare would have charged. So the concept there is, you see, it doesn't pay the $1,400, it's just going to charge you a different amount. Another example is an Advantage plan does not pay the 20% that Medicare charges. Because technically, if you're on an Advantage plan, Medicare is not paying 80%, so there's no 20% to pay. Instead, it's going to replace it with its own charge depending on what service you're getting done. So if you're getting a knee replacement, for example, it's not like Medicare is going to pay 80% and your Advantage plan pays the other 20%. It's just very different. You might have a 10% coinsurance charge for a knee replacement on the plan you choose. A 20%. It might be 30 or 40% if you go out of network. You might have a flat copay for it. It might be $450. The point there is it does not pay the 20%. You will still have a fee for it. Same thing with a doctor visit or lab work. You know, if you have Medicare and you go to the doctor, you're going to have a small deductible. Medicare is going to pay $80 and you pay their 20%. If you have an Advantage plan, you're going to have a copay. If it's primary care, it could be $0 or $25, depending on your plan. If you go to a primary, it could be $30 to $70, depending on your plan, or for a specialist. So you're just going to have each Advantage plan has its own summary of benefits or fee schedule. Now, Medicare Advantage plans, you do have what's called a max out-of-pocket, to where Medicare does not. But if you have Medicare Advantage, you will have a max out-of-pocket anywhere from $5,000 to $12,000, depending on the plan you choose. So, to summarize the Advantage plan, it's not a supplement. Okay, so it's not a supplement. You are going to have a copay or a bill for everything you do up until you reach that max out-of-pocket. You are giving up your right to go to any doctor, any hospital. You have an HMO or PPO. You have prior authorizations. Now, that's nice about it, it is low premium. Okay, they're not zero premium because you still pay your Medicare Part B premium, but there's no additional premium most of the time for Advantage plans unless you live in a rural area. Then you might have like anywhere from a $40 to a $70 charge. So that's an Advantage, not a supplement. Give up your right to go to any doctor, any hospital. So you have an HMO or PPO, and you're going to have bills for things you do until you reach the max out-of-pocket, and that max out-of-pocket resets every year January 1st. So if you reach the max out-of-pocket in October, it's going to reset again in January. So that's Medicare Advantage. Now let's go to the other side of the T-chart, which is Medicare Supplement. Medicare Supplement is also called Medigap. Now this is the best coverage you've ever had in your life, and here's why. If you go with Medicare Supplement insurance, you're going to stay on Medicare as your primary. So you're still going to pay Medicare the $144 a month for your Medicare Part A and B. You're going to pay an insurance company an additional premium, anywhere from $80 to $150, depending on your age, where you live, your zip code, if you're tobacco, certain discounts apply, but you're going to pay an additional premium. But in return, that supplement actually pays the bills that Medicare doesn't pay. So I'm going to use those same examples. I'm going to use hospitalization and a knee replacement. If you have a Medicare supplement and you go to the hospital, you're going to have your Medicare Red, White, and Blue card, and you're going to have your Medicare Supplement card. If you go to the hospital, Medicare is going to charge $1,408 in 2020. If you have a supplement, either Plan F, G, or N, and you're admitted, all those plans pay that $1,400 for you every single time. So if you have Medicare and a supplement, you will not have any hospital bills in 2020, whether you go to the hospital once or you go 5 times, whether you're there a week or you're there 6 months. Between Medicare and your supplement, Medigap, either F, G, or N, you will not have any hospital bills. If you get a knee replacement, Medicare is going to have a small deductible of $198. And then if you choose a G or an N plan, once you pay that $198, Medicare is going to charge 80%, and all three, F, G, and N, are going to pay that 20% for you every single time. So Medicare pay 80, your supplement pays 20, so you have no bills. If you have Plan F, you have no bills for that knee replacement. If you have G or N, you just pay that $198 Part B deductible. And then Medicare pays 80 and the supplement pays 20%. Also with Medicare Supplement insurance, because Medicare is your primary, you keep your right to go to any doctor or any hospital that accepts Medicare. You have nationwide coverage. So if you have 2 houses and you want to get routine care in North Carolina and Florida, a supplement's a great fit because you have the same coverage in both states. If you live in Georgia and you want to go down to Florida for the Moffitt Center because you get diagnosed with cancer, with the supplement plan, you can do that. You can go to any doctor, any hospital that accepts Medicare. You never have to get a referral or prior authorization. Now, here is something that I have highlighted here that is very important when you are initially deciding between Medicare Advantage or Medicare Supplement, or even as you go on in life and decide you might want to try one or the other. The only time in your life that you're automatically accepted into a Medicare Supplement plan is when you first turn 65 or you're new to Medicare, Part B. That is the only time you can get a true Medicare Supplement, F, G, or N, Medigap coverage without answering any health questions. So if you go with the Medicare Advantage plan and then later you want to upgrade to a supplement plan, you will be subjected to medical underwriting, so you may not qualify to go from an Advantage plan to a supplement. If you have a supplement plan and you feel like your premium's getting too expensive, and so you want to try a Medicare Advantage plan, and you do that, and then a couple years later you want to go back to a supplement, you're going to have to medically qualify. So a big takeaway is just understand, let's say you're 67 and you're like, hey, I'm pretty healthy, I'm active, I don't really think I'm going to use my insurance that much next year, which again, we don't know, we don't have a crystal ball. But let's say you tried that Advantage plan. And so you go with an Advantage plan, and then you need a hip replacement or a knee replacement, and you see that, oh my gosh, I had to go get a referral, and I can only choose from 2 or 3 different orthopedic surgeons, and none of them got great ratings, so I had to settle for a certain doctor, and then I had to pay $2,500 for that, and then I had to pay $40 3 days a week for physical therapy. Wow, I need to get back into my supplement. Well, if you call us, and you want to, or anybody, and you want to go from an Advantage plan to a supplement, you have to be subjected to medical underwriting. So that's why, if you're looking at saving money on your premium, I would recommend, instead of going from a supplement to an Advantage plan, then I would recommend going maybe to a different supplement. Maybe go from an F to a G, or an F or G to an N plan. Maybe that has a lower price supplement that has a little more cost exposure, but is still a true supplement. So here's a question that I ask people all the time that help them decide between, are they a Medicare Advantage type person or a Medicare Supplement person? I look at just kind of worst case scenario on both sides of the T-chart. If you go with a Medicare Advantage plan and you have a bad year, not only are you restricted where you can go, but you're gonna have to meet that out-of-pocket limit. And if it's cancer or open heart surgery or something like that, and you meet that out-of-pocket, let's say in October, and you have follow-up surgeries or follow-up procedures or treatments come January or February the following year, you're gonna meet that max out-of-pocket again. So realistically, if you have a plan that has a max out-of-pocket of, let's say, $6,700, you could meet that within 6 months, because it's gonna reset in January. And now you're stuck in that system until you're healthy enough to get onto a supplement. So that's worst case scenario with an Advantage. Worst case scenario in a Medicare Supplement plan is, let's say you choose a Medicare Supplement Plan G at $100 a month. And you go all year, and you really don't use your plan that much. You have a healthy year. You go to the doctor maybe 2 or 3 times, maybe go treat a sinus infection, no surgeries, no procedures, no cancer, no open heart surgery, no physical therapy, nothing crazy. So let's say you really have a great year health-wise. Well, are you going to consider that $100 a month, a waste of money? Like, oh darn, I don't see the value in this. I really should have gone with something else. I should have gone with the Advantage and gambled with that. Or do you look at that supplement premium as a cost of living? Because you're 65 or older. It's not a matter of if, but a matter of when you're going to need good health insurance. You're paying for flexibility with a supplement, because you can go to any doctor, any hospital you want to go to that accepts Medicare. You're paying for predictability. I don't care how much money you do or do not have. We all have the same fear as we get older, which is, are we going to run out of money? And typically, most seniors I talk to are on a fixed income. Well, their biggest unknown cost is healthcare. So what a supplement allows you to do is it takes your biggest unknown cost and makes that a predictable cost. Because as long as you pay that premium, you're not going to have any big bills or surprises for a supplement. So if you would consider that supplement a cost of living, then you're absolutely a supplement person. If you, no matter what, cannot afford a supplement, okay, or you just feel like, you don't see the value in it, then choose a Medicare Advantage, and we'll help you navigate and get you an Advantage plan that meets your needs. But you really need to understand the differences, because once you choose if you're an Advantage person or a Medicare Supplement person, then it's really easy for us to make a recommendation on which plan in those coverages is right for you. If you would like our help with choosing a Medicare Advantage or a Medicare Supplement plan, just give us a call. The phone number is listed on the video. You can also go to our website, MedicareBob.com. We'll take you right to SeniorHealthCareDirect.com. Please follow our Facebook page. Please follow our podcast, our YouTube channel. Please hit subscribe button so I keep everybody up to date all the time on changes to Medicare. And if you'd like our help, there's no charge for our services. There's no fee. Our services are absolutely free to you. You pay us nothing, and we will help you decide whether Advantage or Supplement. And then once you decide what coverage you want, we'll get you the best value for your plan, because we represent all the top plans and carriers. So thank you so much for watching. If you have a question, just drop it in the comment box below, and I'll be happy to answer it.